Diabetes isn't one disease, it's 8. They all end the same way. Sugar trapped in your blood when it should be feeding your cells. But the path there is different every time. Most of these types you've never been told existed. Some are misdiagnosed in millions of people every year. By the end of this video, you'll know every one of them. Let's start with the most common and the most ignored. Prediabetes. Your blood sugar is higher than it should be, not high enough to be called diabetes. Yet, here's what's happening. Your pancreas makes insulin. Insulin is the key that opens your cells so sugar can get in and become energy. In prediabetes, your cells stop responding to the key, so your pancreas makes more, then more, then more. For a while it works, blood sugar stays close to normal, you feel fine. That's the trap. No thirst, no weight loss, no symptom. You go to work, you eat, you sleep. Meanwhile, your blood vessels are already getting damaged. People think prediabetes is just a warning. It's not. The disease has already started. Quietly. 96 million Americans have it. Around 80% don't know. 1 in 3 adults walks around with their pancreas working overtime. Risk goes up if you're over 45. If diabetes runs in your family. If you carry weight at your waist, if you sit most of the day. Losing 5 to 7% of your body weight cuts your risk of type 2 in half. 30 minutes of walking a day works almost as well as medication. Prediabetes isn't a sentence, it's a question your body is asking. For some people, the body doesn't break slowly, it turns on itself. Type 1. Your immune system makes a mistake. It looks at the cells in your pancreas that make insulin, it decides they're the enemy, then it kills them. Slowly at first. One by one, you don't feel a thing. By the time symptoms show, 60 to 90% of those cells are already gone. What does it feel like when it finally shows? Sudden, crushing thirst. Constant urination. Weight you can't keep on no matter how much you eat. Fruity smelling breath. Vision blurring. Crushing fatigue. In kids, it sometimes starts with bedwetting after years of being dry. People think type 1 is a childhood disease. Wrong. Around 64% of new type 1 cases happen in adults aged 20 to 59. Sugar didn't cause it. Bad parenting didn't cause it. Nobody caused it. Type 1 happens in 3 stages. Stage 1, the attack begins. No symptoms. Stage 2, insulin production drops. Still no symptoms. Stage 3, enough cells are dead that sugar climbs and symptoms appear. For 100 years, the only treatment was insulin for life. That changed in 2022. A drug called teplizumab was approved. It can delay the onset of type 1 by more than 2 years if caught at stage 2. First time in a century, we've been able to slow this disease down. Type 1 isn't caused by sugar, it's caused by your own immune system getting confused. Type 1 is an attack. The next type is something else. It's exhaustion. Type 2, it starts with insulin resistance. Your cells stop listening to insulin, your pancreas pumps out more to compensate. For years, sometimes decades, your body keeps up, then it doesn't. The beta cells, the ones that make insulin, start burning out. Insulin output drops. Sugar piles up in the blood. The damage spreads. Eyes, kidneys, nerves, heart. What does it feel like? Often, nothing. For years. That's why so many people are diagnosed after a heart attack, a foot wound that won't heal, or a routine blood test. By then, the damage is done. People think type 2 is caused by eating too much sugar. It's not that simple. Sugar contributes through weight gain. But type 2 is a complex disease. Genetics matter heavily. Thin people get it, so do people who eat well. Self-blame doesn't help anyone. Type 2 affects over 400 million people worldwide. About 90% of all diabetes is type 2. Risk, weight around the middle. Being over 45. Sedentary lifestyle. Family history. Certain ethnic backgrounds carry higher genetic risk, including Black, Hispanic, South Asian, and Pacific Islander. Here's what most people haven't heard. Type 2 can go into remission. The direct trial followed people who lost 10 to 15 kilograms through a structured diet. 46% were in remission at 1 year. 13% stayed there 5 years later, off medication, and new drugs are changing the game. Ozempic. Mounjaro. They lower blood sugar, drop weight, and protect the heart. Type 2 isn't permanent. It's not a punishment. It's not your fault alone. Type 2 takes years. The next type takes 9 months. Gestational diabetes. It only happens during pregnancy. The placenta makes hormones that purposely cause insulin resistance. That's how the body sends more sugar to the baby. In some women, the pancreas can't keep up. Blood sugar climbs. The baby feels it. Extra sugar crossing the placenta makes the baby produce more insulin. Babies grow too big. Births get complicated. Most women find out at a routine screening between weeks 24 and 28. No real symptoms until then. People think gestational diabetes ends at birth. The blood sugar usually does. The warning doesn't. Around half of women who had gestational diabetes develop type 2 within 10 years. The baby is affected too. Higher risk of obesity and metabolic problems later in life. Risk: pregnancy after 35, BMI over 25, family history, gestational diabetes in a previous pregnancy. Treatment is diet and exercise first, insulin if needed. After delivery, sugar should be rechecked at 6 to 12 weeks, then once a year, for life. Gestational diabetes doesn't end with birth. It goes quiet. And when diabetes shows up later in life, it isn't always type 2. Sometimes it's something else hiding inside. LADA, latent autoimmune diabetes in adults. Some doctors call it type 1.5. It's type 1 in slow motion. Same autoimmune attack, same destruction of insulin-making cells, but spread out over years. Here's the problem. It looks like type 2 at first. The patient is over 30, often slim, started on metformin, it works for a while, then it stops. Doctor adds another drug. That stops working too. Years pass, nobody checks for antibodies. Eventually, the truth comes out. Up to 12% of people diagnosed with type 2 actually have LADA, potentially millions of people on the wrong treatment. The clue is simple. If you were diagnosed as type 2, you're slim, and your pills aren't working, ask your doctor for a GAD antibody test. It's a single blood draw. LADA is type 1 in slow motion. Millions are being treated for the wrong disease. LADA hides inside type 2. The next type hides in your family tree. MODY, maturity onset diabetes of the young. This one is a single broken gene, passed from parent to child. There are 14 known versions. 3 account for most cases. The mutation affects how your pancreas senses sugar or makes insulin. It's not autoimmune. It's not insulin resistance. It's a typo in the instruction manual. The pattern looks like this. A teenager or young adult gets diagnosed with diabetes. They're slim. They don't fit type 1 or type 2. Their mother had diabetes young. Their grandfather did too. Multiple generations, all diagnosed young. That's not coincidence. That's MODY. It's underdiagnosed. About 80% of MODY patients are first told they have type 1 or type 2. Many are put on insulin they don't need. Genetic testing confirms it. Some forms respond beautifully to cheap, old pills called sulfonylureas. Some forms need no treatment at all. MODY runs in families because it is one, a single broken gene, passed down. MODY comes from genes. The next type comes from damage. Type 3C, pancreatogenic diabetes. This one happens when something physically damages your pancreas. Chronic pancreatitis, pancreatic cancer, cystic fibrosis, surgery that removed part of the pancreas, years of heavy alcohol use. The damage takes out 2 kinds of cells, the ones that make insulin and the ones that make glucagon, the hormone that raises blood sugar when it drops too low. Without that balance, sugar swings wildly. Patients call it brittle diabetes, too high 1 hour, dangerously low the next. There's another piece. The pancreas also makes enzymes for digestion. Type 3C patients often can't digest fat properly. Oily stools, weight loss, constant abdominal pain. It accounts for 1 to 9% of all diabetes cases. Most are misdiagnosed as type 2. Here's a warning sign doctors miss. New diabetes after age 50 with unexplained weight loss can be the first sign of pancreatic cancer. Always worth checking. Type 3C isn't caused by lifestyle. It's caused by damage. Type 3C happens when your pancreas gets hurt. The next type happens when your pancreas never finished growing. Type 5, malnutrition-related diabetes. This is the newest type. The International Diabetes Federation officially recognized it in April 2025. It's been around for 70 years. Doctors just refused to call it what it was. Here's the mechanism. A child grows up severely underfed. Their pancreas doesn't form properly. By the time they're teenagers or young adults, they can't make enough insulin. But they're not type 1, they have no antibodies. They're not type 2, they have no insulin resistance. They have something else entirely. The patient is usually lean, often very lean, living in a low-income country, diagnosed young, often misdiagnosed and given the wrong treatment for years. Standard type 1 insulin doses can cause dangerous low blood sugar. Standard type 2 pills don't work. They needed their own category. They finally got one. Around 20 to 25 million people have type 5, mostly in South Asia and parts of Africa. The IDF is now writing the first proper treatment guidelines. They expect to publish them in 2027. Type 5 has existed for 70 years. Medicine just refused to see it. 8 types, 8 different stories. Some come from genes, some from damage, some from hormones, some from autoimmunity, some from a body that was never properly fed. But every type shares one thing. The right diagnosis matters. The right treatment matters. The right information matters. If you or someone you love has diabetes, ask which type it really is. The one that actually fits. Not just the one written in the chart. Because being on the wrong treatment is worse than no treatment at all.